So hello guys, welcome back to my channel. Today we are discussing about AIAPGET Gynecology and Obstetrics modern topics. Okay. So first we discuss with hymen, circular or concentric in virgins. Yeah, hymen is present in virgins, but it is not compulsory that every virgin should virgin women or a girl should have hymen. Okay, hymen doesn't defines the virginity. Next, vagina. Angle of anteflexion 125 degree, angle of anteversion 90 degree, diameter is 2.5. Vagina contains four walls: anterior 7 centimeter, posterior 9 centimeter, lateral 2 walls. Okay. Then comes fornices, 4 fornices, posterior and deep. pH secretion 4 to 5, it is acidic. Reproductive organ, Mullerian duct. It is an organ of copulation. Then we study about uterus. Uterus is 7.5 into 5 into 2.5 centimeter. In normal women, the weight of the uterus is 50 to 80 grams. In full term, like in pregnancy, 9th month of pregnancy, it is about 900 to 1000 grams. Next, cervix is 2.5 centimeter. The shape of the cervix is head shape. Clitoris 2.5 centimeter. It is compared with penis in male. Labia majora, scrotum in male. Cervix is insensitive to touch, heat, etc. Then vestibule. Vestibule have 4 openings: urethral opening, vaginal orifice, Bartholin ducts, secretion alkaline in nature, Skene's duct. Then comes fallopian tube. Fallopian tube length is 10 cm, diameter at uterine opening is 1 mm, diameter at pelvis opening is 2 mm, having 4 parts: intramural or interstitial 1.25 cm, isthmus 2.5 cm, ampulla 5 to 7 cm during fertilization. Ampulla is for fertilization. Next, infundibulum 1.25 cm. Next, we go with the ovary. Ovary is oval or in almond shape. It is 3 into 2 into 1 centimeter, pinkish grey in color. Next we go with the secondary sexual character like breast. Breast, we can also call it as a modified sweat gland. Ectoderm, parenchyma, mesoderm, stroma, position 2nd to 6th rib. Then comes umbilical cord, having 2 umbilical arteries, 1 umbilical vein, 50 cm in length, secretes Wharton's jelly, diameter is 1.5 cm. Cord, length, it is 100 cm long, normally 50 cm, and short is 20 cm. Next, absent in exam phallus of the baby. Next, fetal circulation changes at birth. We all know that soon after birth, the fetal circulation changes. Okay. So first we go with the umbilical artery. Umbilical artery function closes at birth. Anatomical changes can be seen in 2 to 3 months. Next, umbilical vein. Soon after closing the artery, the umbilical vein functions also closes, and the anatomical changes occurs in ligamentum teres. Next, ductus arteriosus. At birth, after establishment of pulmonary circulation, 1 to 3 months becomes arteriosus ligamentum. Then comes foramina ovale at birth, function closes at birth and anatomical changes at 1 year. Then ductus venosus, lig venosus. Then we go for fertilization. Fertilization occurs in ampulla, decidua, endometrium of uterus. 0 hours fertilization, 30 hours it comes in 2 cell stage. It is called as blastomeres. Then 90 hours, 16 cell stage, it is called as morula. 5th day implantation, it is blastocyst. 10th to 11th day implant completely. 6th to 12th week placenta formation. 21st to 22nd week, fetoplacental circulation starts. Next, we start with objective signs of pregnancy. Okay, first trimester. First trimester means 1 to 3 months. Okay, in first trimester, we can see Godel sign, in which cervical sign, it is Godel sign is also called as cervical sign, in which cervix becomes soft, bluish discoloration of cervix. These two words are very important, cervix and bluish. Cervix soft, bluish. Okay. This usually takes place in 6th week of pregnancy, means at 1.5 months. Then comes Jacqueminot sign, also called as Chadwick sign. It is a vaginal sign, dusky anterior vaginal wall. Means vaginal wall anteriorly turns into dusky skin color. Okay. This we can see in 8th week of pregnancy. Then comes Osiander sign. It is also a vaginal sign. Pulsation through lateral fornices. We can feel the pulse. Next, bluish discoloration of anterior vaginal wall. Okay. In Osiander sign, vaginal wall becomes bluish. Wall becomes soft. If cervix becomes soft and bluish, then it is Godel sign. If vaginal wall becomes soft and bluish, then it is Osiander sign. It is 8th week of pregnancy. Then comes Palmer sign. Regular rhythmic contraction can be felt during manual examination. When we do per vaginal examination, then we can feel the contractions like uterine contraction we can feel through examination. This we can see in a 4th and 8th week of pregnancy. Next we move to Heger sign. Heger sign, abdominal and vaginal fingers seems to be opposed because of variation in consistency. Cervix is firm, like abdomen and vagina finger seems to be opposed, like the pressure of abdomen and vagina is like this, finger seems to be opposed, one opposite to other, like this. Okay, because of variation in consistency. It is in the 6th to 12th week of pregnancy. Next, Piscac sign. It is a uterine sign, asymmetrical enlargement of the uterus due to lateral indentation. Uterus is not symmetrically enlarged due to lateral indentation. This we can see in 6 to 8 week of pregnancy. Then we move to second trimester. Quickening sign, feeling of life. Quickening in the sense, mother feels some movements are happening in her uterus, like that. That is called as quickening sign. Usually patient come with the complaints of, I can feel the baby, I can feel the movements of the baby. That is called as quickening sign. It is seen in second trimester of pregnancy in the 18th week. Okay. Then Braxton Hicks contraction. Spontaneous contraction, irregular, infrequent, spasmodic, painless, without dilation of cervix. Braxton Hicks contraction, like the contractions may be, the mother feel like in a few hours the baby maybe get delivered, but it is spontaneous and it is irregular. Like in the normal delivery, the labor pain will be like every 2 minutes, every 5 minutes, the mother will get the pregnant women will get a pain. But here it is irregular, not like every 5 minutes or 3 minutes, and infrequent, spasmodic, like spasm is present, but it is not pain, it not having any kind of pain, painless, and without dilation of cervix. Obviously it is not the term gestation, so there is no dilation of the cervix. Okay, it's just like a false pain. Then it can be seen in a 18th week of pregnancy. Okay, external ballotment, fetal part feel in the 20th week of pregnancy. FHS, fetal heart sound, in the 20th week of pregnancy. Then comes third trimester, internal ballotment, ptosis amniotic fluid, 28th week of pregnancy. Lightening sign, sense of relief. When the baby's head turns from breech or any other position to vertex presentation, then the crown, at the time of delivery, the crowning takes place. Then mother will feel lightening in her uterus or in the upper abdominal region due to the head turning in a vertex position. Okay, we can see this lightening sign in a 38th week of pregnancy. Okay, Next we see some important points. Amniotic fluid is found in 10th week of pregnancy. Stries visible in 12th week of pregnancy. Vernix caseosa from 5th month. Linea nigra visible at 12th week. Chloasma 24th week. White pigmentation overhead, like chloasma is white pigmentation over forehead. Okay. Uterine shuffle, fetal shuffle. Uterine shuffle means uterine vessels. Next, fetal shuffle means umbilical veins. Okay. Then, shape of the uterus. Non-pregnant uterus is pyriform shape. At 12th week of pregnancy, it is globular. At 28th week, it is oval. At 36th week, it is spherical. Then uterine signs. 6th week, it is hen's egg. Okay, hen's egg, almost this much. Okay, hen's egg. Next 8th week, it is cricket ball size. Next 12th week, it's a fetal head size. Then we move to fundal height. At 12th week of pregnancy, pelvic, it's considered as a pelvic organ. 16th week, midway between pubis and umbilicus. Okay, see, this is abdomen. This is somewhat here pubic symphysis. Here is umbilicus. Midway between pubic symphysis and umbilicus, like imaginary line, is the 16th week of pregnancy. Okay, then 28th week at the level of umbilicus. Here it is 28th week. Okay, next, 24th week. 28th week between umbilicus and cartilages. Here, maybe here cartilages ends, like here at 28th week of pregnancy. Okay, at the point of upper 2/3 and lower 1/3. Okay, next, some signs of pregnancy. Amenorrhea, morning sickness is seen in 4 to 16 weeks. Increased maturation up to 12 week. Breast, 2nd month, Montgomery follicles. Primary areola generalized enlargement. Breast, 5th month, secondary areola and secondary follicles. Next we move to changes in breast. Best seen in primigravida, like in first pregnancy. Ductal development due to progesterone. Alveolar development due to progesterone. Montgomery tubercles are sebaceous hypertrophied glands. Breast secretion first appear at 12th week of pregnancy. Next we move to the very important topic, that is labor. We have to remember the definition of labor as it is. Okay, normal labor. Normal labor is a series of events takes place in genital organ to expel viable products of conception out of the womb through the vagina in outer world. These three words, out of the womb, through the vagina, in outer world. Okay. First, normal labor is a series of events. Like so many events takes place in series in normal labor. Okay. Where it takes place in the genital organ. Why it takes place? To expel viable products. Viable products of what? Of conception. From where it comes? Out of the womb. Through vagina. To the outer world. Okay. Have you got my point? Now let's repeat the thing. Normal labor is series of events takes place in genital organ to expel viable products of conception out of the womb through vagina in outer world. Okay. Next, prior to 37 weeks, it is called as preterm. Signs of true labor. Okay. Labor pain, like contraction. Show means blood stained mucus comes out from the vagina. It is called as show. Next, effacement, thinning of cervix. See, this is cervix. If this space increases, okay, this space increases, it is called as dilation. Okay, and just imagine this is cervix. If this space, okay, the length, if this decreases, If this decreases, it is called as effacement. Effacement. Okay. Next, dilatation of cervix. We have seen this is dilatation. Next, formation of bag of water. Next, we study the stages of labor. Totally, there are 3 stages: first, second, third. Their signs, the time required particularly in multipara and primipara. Okay. First stage is onset of true labor to the full dilation of cervix. It takes about 6 hours in multipara, and in primipara it is 12 hours. Okay. Second, full dilatation of cervix to expulsion of fetus. Multipara 30 minutes, primipara 2 hours. Third stage begins after expulsion of fetus and ends in the expulsion of placenta. In both multi and primipara, it is 15 minutes. Okay. Further, we continue in the next class. Okay. Thank you. Bye-bye.